we shall discuss regarding the interesting profession pharmacy. So pharmacy is like when we are taking pharmacy as a professional thing, we are having an advantage. What is the advantage is in this healthcare in India, all the prescriptions, whatever prescriptions in allopathy has done a magical code. Okay, are you getting me? What is going to be a magical code?
Yes, ma'am.
So nowadays what had happened is we had got transformation. That is, in initial days we are practicing some traditional medicines like Ayurveda, Unani, Siddha, and Ayush, homeopathy. Okay, so this is called as Ayush. Ayush means Ayurveda, Unani, Siddha, homeopathy, and yoga sciences. So from that traditional, in the chart of Sushruta system, we have got transformed into, when like British people entered here, we have got some allopathic medicines. So for example, salicylic acid. The salicylic acid we got from the tree. Salicylic acid is compound which has been extracted from the tree. Okay. So from the tree we have got like salicylic acid. So the molecule is phenol carboxylic acid. So salicylic acid is, it is a phenol and carboxylic acid. So it contains both phenolic hydroxyl group and the carboxylic acid. So once this salicylic acid is, we have isolated means separated from the bar, we could found that that particular drug is effective in pain, like the treatment of pains. So after that we have got derivatives. So we have got salicylic derivatives like methyl salicylic, salicylic acid, which is called as aspirin, and these are all magical drugs. Aspirin, if you take aspirin, aspirin is doing a wonderful job in CNS, that is central nervous system. If a person gets a clot, that is the signal is not connected, for an elderly, geriatric patients, we can call geriatric means elderly patients, and pediatric patients means younger children, neonates means newborn children. Okay. So when this comes into action, what has happened is everybody, most of the drugs, somebody asks you what is the role of pharmacist means, even all the prescriptions, if a person, we can say proudly like we are saving the life of elderly patients. We are having a contractory many things in India, traditional system overcoming allopathic and side effects, adverse effects, all other, besides all other like conflicts, we have one particular thing, that is we can extend the life of a cancer patient. Are you agreeing with me?
Yes, ma'am.
So there is a system like if you heard like in the late 90s, we don't have medicine for the treatment of cancer. Cancer stage 1, stage 2, stage 3, stage 4. So stage 1 is very much curable. So somebody, we are getting even though you are dealing with prescriptions, pharmacy, drugs, chemicals, all of the things, we are in a proud place to study the prescription and also to go to the like what I can say is scan reports, all the biochemical reports. You may ask me a question like, I am in first semester, why I have to study all this? Because in the future scenario, we are moving towards many healthcare, like when a prescription, so like you are given a prescription. For example, I am giving you a prescription. Okay, you are saying that there are 4 compounds. Okay, if it is containing like aspirin, and if it is containing one diazepam, it is containing one ranitidine. Ranitidine is like H2 receptor antagonist. Ranitidine is what? So if you take any acidic substances, it is going to affect your stomach. It is going to affect what? Stomach. So in order to suppress the secretion of the gastric juices, we are going to give it H2 receptor antagonist, that is ranitidine. Okay. So you are going through the prescription. What will you do? What you have to do? You are taking, like if you go to grocery, to a retail shop, what they will do is you are asking rice, pulses, you are asking green gram, you are asking mega gram. You will take and give. Am I right? But when you are given the prescription, what you have to do is, read the name of the patient. What do you have to do? Read the name of the doctor and age. So you are given with the doses. For this particular age, whether the dose is calculated correctly. So we have to spend some 2 minutes in the prescription and we have to analyze the prescription. So what is the second job? Analyzing the prescription. Okay. So then the dose is calculated, it's right, and you have to tell the patient for what it is given and what are all the things he has to do. For example, he is taking any salicylate, he has to drink more water. Any drug, any chemical enters the body. What I have told you is to listen. Okay. Any chemical which enters the body, it has to be excreted through either through the feces or through the urine. So it or through the skin as a sweat. So when it is getting excreted, you need to you have to infect them like paracetamol. If you are taking, it will lots of sweat will be there. So don't get worried because if you get sweat more, what the patient will think that I'm having a blood pressure like that. Okay. So all these things. So what I mean to say here is, you are qualified professional. When you become a qualified professional pharmacist, proudly you can say one thing, one particular thing, that is, you can save your family's health, your personal health, your friends' health, your neighbor's health, your pediatric, your geriatric. And when the prescription dispensing is, you are dispensing a medicine, when the dispensing time is enhanced, you are not giving the medicine as such, you are instructing the patient like, you have to take this in this time, you have to take this, for example, atorvastatin. It has to be taken in the night only. Why means cholesterol will be secreted in the night. We have seen in one seminar, we have seen the interactions, isn't it? What is the time? Fastest means night, like that. Okay. So like that, the prescription time has to be enhanced. That means you have to be little empathetic towards the patients. What do you mean by empathetic? Can you define empathetic? Any more clarity? Empathetic means, what do you mean by empathetic? Clear, very good. Kindness, care, super, good. Then any other phrases? Any other phrases for empathetic? You have to stand in their shoes. For example, a patient is coming, is having ulcer. You are going to give an anti-ulcer. You have to instruct him that you can take this Thakkali juice. Karinju pittu keeran solluvaanga. And then, so you can tell them like daily you take this Solarium species. This belongs to which species? So you can advise them to go to market. This will do this type, this N types. So this foods you have to take. Drink more water. Don't, if you feel a little hunger also, feed your stomach. All these things you have to instead of. So you have to tell them drug-drug interactions, drug-food interactions, adverse effects, and also physical examination. On seeing the patient, you have to understand like some patients are coming, you have to understand 1 or 2 degrees, if the fever is there, you have to ask them to sit and you have to counsel them. So in India, there is a challenging thing and outcoming source. If you are able to counsel a patient in an effective way, definitely they will come to you only. Even hundreds of competitors are there, they will come to your pharmacy because you will do a effective counseling. You should develop the patience of listening. You have to listen to the patient carefully. What are all the interactions? So you must not think that one week I have to study about the drugs. Okay, there are 2 important references. One is Chemical Index of Monthly Specialties, SIMS. What is that? And then Monthly Index of Medical Specialties, MIMS. What are the 2 things? SIMS, MIMS. SIMS and MIMS will give you a beautiful idea about a particular drug. It will give you a drug, structure, interactions, kinetics, dynamics, then brand names, excretion, and busyness, headache, vomiting, nausea, or severe sweating. All these things will be given in the adverse effect. Okay. So this is what. So to conclude today, I have to say that be proud of your profession, have the professional value while you are dispensing a prescription, and also have patience in listening to the patient carefully. And moreover, daily you learn about one drug discovery. Today what's our work assigned is, why I have chosen the profession is because I am going to serve the society in a better way. By means of either a scientist by producing the chemicals, or your industry or research scientist, or you are a dispensing pharmacist, or a hospital pharmacist, or a clinical therapist, anything, you clinical pharmacist or pharmacologist, like that, you have many branches. But when you enter pharmacy, the sole responsibility is healthcare. What is the sole responsibility? Healthcare. So this is the main thing. So when our friend is suffering, just be empathic with your own peer group. Okay, and have your discipline here. So listen all the factors and discuss. Okay. So this is what I have to conclude. Simpson means you remember, and also you just learn drug by drug, and also learn a drug discovery. So I want to thank you one and all for your patience. So as a pharmacist, we are supposed to learn the drug discoveries, which makes us feel proud, and we can find a need also in future. There are two options. You can find a need also. It will give you a lots of energy. Or this way, this drug has to give you a lot of enthusiasm. Okay. Thank you.